4, 3, 2, 1, live.
Hi, I hope you are well, and thank you so much for joining us at this People's Assembly event in what is completely bewildering times. If you have never been to a People's Assembly meeting before, you're very, very welcome. To people who have been a lot of People's Assembly meetings before, hello again. It's strange to kind of meet you in our living rooms and kitchens and bedroom floors or wherever people are speaking from. And this meeting is called Making Sense of the Crisis, and it's called that because, as I said before, it's very bewildering to have lots of the country not allowed to go to work, not allowed to go out of the houses, some still having to go out, not clear whether they should or shouldn't, people worried about their incomes, about their housing status, all because of this hugely concerning virus. And this meeting really is about us getting together and making some sense of this crisis. So thank you so much again for joining us. I want to thank so much the speakers for joining us too. We have an amazing lineup of people who have been incredibly busy practically dealing with the crisis. We have Dr. Sonia Adesera, we have Kevin Courtney, who is the General Secretary of the National Education Union, we have Lindsay German, the convener of Stop the War Coalition, and economist Grace Blakely with us too. This is how it's going to work. So they're going to give us their initial impressions on the crisis, so what they think about what has happened so far, what they think needs to happen, and where the gaps are in provision from the government. And I'll just make this point before we start. I have seen some people being quite critical about having opinions of the government in this period, and I kind of get that sentiment in the sense that I don't think any single person does not want the government to succeed. We all want them very much to succeed in bringing this virus under control, and we wish them well, but we are also, of course, entitled to our opinion about where the gaps are for people and provision, and the people invited here tonight certainly do have those. So they'll give those initial impressions, and then we'll try and leave the last 20 minutes or so, 25 minutes, for all of the people that are watching to ask their questions to the speakers and to have their say. So that is how it's going to work. Now, we are going to stop at around 5 to 8, because you will know that at 8 o'clock we are all being encouraged, of course, within the guidelines on self-isolating, to get to our windows or our balcony or wherever it's safe to do, and have a collective clap for the NHS. If ever there was a time we need to show our gratitude to all of those people, actually all of the people actually still having to go out to work, it is now. If you want to get involved with the People's Assembly, I'm just going to say another couple of things, and we're going to go straight to our first speaker. If you want to get involved with the People's Assembly, perhaps you are interested in getting involved in being an activist, or you want to join a local group, all you have to do to find out how to do that is email office@thepeoplesassembly.co.uk, and I'm sure that can be put on one of the comment boxes. I think if you are watching this, everyone will be watching it from a mobile or a computer, please press the share button so that we reach a wider audience for what are about to be some fantastic contributions. We want to grow the number of people that are seeing some of these meetings. This is the first in a series of meetings, some practical, some much more political. Next week, we're going to be looking at mental health during the crisis and how we can keep ourselves mentally well, with, again, an excellent panel of people. Please share this so that other people can take part. This is a lonely and isolating experience for many people, and we want to be part of that community online. And lastly, probably the most embarrassing thing you have to say is that we want to keep the People's Assembly going through this crisis. We want to make sure that that we can keep going, that we can keep campaigning, that we can keep putting on these meetings where we convene thoughts and ideas and action. So if you have any spare money, I know things are tight for people right now too, but if you have any spare money at all, please donate to the People's Assembly. So Our first contributor was supposed to be Yanis Gotusar-Yanis, but unfortunately he is dealing directly with the virus, and there have been some new cases and he just could not be with us. We all completely understand and wish him well. But what a fine replacement we have in Dr. Sonia Adesera, and I'd just like to hand over to her first. Sonia, I want to think about I want you to sort of us off essentially. And I want to ask like a really basic question, because I know other people will be embarrassed, but I want to know, like, what is a virus? What is going on here in society? How do we protect ourselves? And importantly, for this meeting, what is your impression of what has happened so far in the health service? How is it coping? And where are the gaps in provision, essentially? So take it away. There's, I know, a lot of us there, but just let us hear your first impressions.
Okay. No, you keep cutting out. I think my internet might be bad. So if you can't hear me properly, I might have to re-sign in again and use my phone instead. But can you hear me okay?
I can hear you okay. I've got other people listening, so if there's any problems and you do keep cutting out, Sonia, I'll go to another speaker and then come back to you, okay? So don't worry about it.
And Ziza had a lot of, so he's not able to hello, so
Hi, Sonia, could you do what you asked and we'll go to Kevin Courtney? Just the sound is a little bit crackly. So sorry to jump straight in to Kevin, but what a time to be the General Secretary of a huge teachers organisation, the largest trade union representing teachers. Again, I just want to know what your initial impressions have been. Where have your members been at? What has been happening in schools? What has your union been campaigning on? And again, what do you think the gaps are for teachers and teaching assistants and all of the other amazing people that work in schools that are still going into schools now?
Thanks very much, Laura. We've got loads of members who are very scared for themselves or scared because they've got vulnerable people they're caring for. We've also got loads of members who are really worried about children who are at home, some very vulnerable children at home, without, where they're worried that they might be hungry, they're worried they might be hurt in other ways. So this is a real crisis for all of us. We started thinking about this when we first heard about the first cases in China, but it's clearly just hugely catching up on us. We were writing to Boris Johnson saying, why are our schools still open when other European countries had closed theirs? And then we saw the evidence from Imperial College, and I read the study that Imperial College did, which makes it absolutely clear that we cannot get the virus under control in this country now without closing the schools, as well as all the other social distancing and hand washing measures. So we know that closing the schools is extraordinarily disruptive and difficult, and cancelling the exams, which was the right thing to do, but that's extraordinarily difficult for those year 11 pupils who've worked 2 years for their GCSEs and the year 13 pupils working for their A-levels. It's terrible for them as well, but it's the right thing to do for our society, we think. So we've been trying to deal with this as a trades union and trying to deal with it as a socially responsible social justice trades union. So on the one hand, we've been giving really clear guidance that if somebody is in a vulnerable category, that, if they've got asthma or if they've got chronic COPD, chronic lung, chronic heart disease, if they've got sickle cell or Parkinson's or HIV or AIDS, then they really shouldn't be in school. And the government sort of agrees with that. And we've gone a bit further though as well and said that if they're a carer or if they live with someone in those vulnerable categories, we think they really shouldn't be in school either, because there's a really enhanced chance of them taking the virus home, their loved one getting really ill, and then that person being in the NHS and taking bed space. So for all those reasons, we think those vulnerable people shouldn't be there. And we've been taking a trades union response on that and doing that very well and getting some real success on that. But then we've also been saying to all our other members who aren't in those vulnerable categories that we really want them to be in school, because what we're being told by the scientists is that we should close the schools to the vast bulk in order to stop viral spread, but that we need our NHS workers to be at work. And if they've got you know, if they can't find an alternative way of looking after their child, then we want to be there for them. And we've got we've got members who are quite worried about being out with kids of NHS workers who might have more chance of having the virus, but they're doing it. They're doing it because we're socially responsible. We've got that orientation. So that's what we're doing at the moment. We're working with members on how they can help parents at home who are looking after their kids, and what do we do about learning during this period. So we've got lots of people looking at that. We think there's lots more that we need. There are a whole set of people that we represent, agency supply teachers, agency TAs, who aren't being paid. We're working hard to understand what the Chancellor said today, but we've been in a place where people have felt they needed to go to work, and they might, before the close down, have been going to work while still ill. So it's really important that those economic needs of people are sorted out, I think. We're also thinking now that in the schools that are open for kids of NHS workers, for overlooked delivery workers, we need people delivering food, for the people who are going to produce ventilators, etc. We need those schools to be safe as well. So they need to be properly cleaned. They need to be cleaned repeatedly. We think in some settings we do need personal protection equipment. We understand the NHS has the first call on that, but we think it should be after it's got to NHS workers, it needs to be rolled out to the people who are cleaning on the tubes, cleaning in the schools, and doing those sorts of things. We think that there needs to be a lot more testing available, and there needs to be antibody testing or other testing. But we think that some teachers are at home self-isolating when they've already had the disease and are clear of it. Some of them will be home self-isolating when they aren't ill. So we think it's right, to be in this place of the shutdown that we've got now. We know that we have to close the schools to help close the virus down. But I want to say that the government really needs to use this time. This is a huge inconvenience for everybody. And like you were saying earlier, Laura, some people are going to find this really difficult, being at home, locked in like this. Some people are going to find that really difficult. And the government, we're making a sacrifice. The government has to use the time. When we're driving down the viral spread at this moment, when we come out of that, the government has to have testing. It has to be able to do contact tracing. It has to be able to do quarantining. We've got to learn from South Korea and the other countries that have got this much more under control. At this end of this period, we need ventilators to be available. I mean, I'm a 60-year-old man with a mild case of asthma, and I'm looking at Italy, and they're saying in some hospitals in Italy, they won't intubate anybody 60 or over in a hospital in Milan. That's a really scary place. So we need to the government needs to find far more ventilators for us. We're all making this sacrifice. There needs to be all those activities put in place before we finish. And if I would like to say one other thing, that there's lots of ways of thinking about society, and some conservative thinkers, Margaret Thatcher used to talk about people as economic individuals, or she said there's no such thing as society, or a quote like that. There's only families acting in their economic interest. And one thing that's just absolutely clear is the virus doesn't see us like that. The virus doesn't see us as atomized people. It doesn't see us as nation states or as classes or as races. It's attacking all of us, and we have to respond in that sort of way as well. So not only do we have to do things to get the virus under control in our country, but it seems absolutely clear we have to help the sub-Saharan African countries, because if it spreads massively there, then it can mutate there and come back here even after we've had the disease. We can get it again if it mutates in that way. I think, and I don't think this is a political point, we should end the sanctions against Iran, because people are dying there because the sanctions are in place, and that means the virus is spreading more. And again, I mean, this is a position I have politically, but I don't think it's a political point at this moment. They should end the blockade on Cuba. The Cubans have some treatments which seem to work, which were working a bit in China, and we need to have the whole world dealing with this whole world crisis. I said it attacks people no matter what their race or class, but the impacts will be worse on working class people. And we really need to look at the fact that some people are going to work now because they're poor. We have to correct that now, and we have to We have to work for a society where we don't have that in the future.
Thank you so much, Kevin. I think you've raised so many points there, not least some of the confusion around employment status, and then what impact that has had on whether people feel like they can not go to work and self-isolate, or whether people are forced in because of financial reasons to their place of work. And I think you're absolutely right in saying the immediate reaction that has happened, that I've seen in my own community and online, is this real sense of community, that there is a natural instinct for people not to close down and preserve themselves, but to want to help people actually who are the most vulnerable in their society. And I think well done for all your action on making sure that you are representing members, making sure that teachers are as safe as possible. I am sure there will come a point where you have to, as a union, take more decisions and about the safety of your teachers and support staff and cleaners in schools and all of the other fantastic people that work there. And we'll probably have some questions for you on that in a moment. I am going to come to Sonia now. Hopefully Sonia can be heard and the internet is okay. Sonia, thanks so much for coming back, and I won't reintroduce you. I'm just so grateful that you are here. Please tell us your initial impressions and where you think the gaps are.
Okay. Can you hear me all?
Yeah.
Yeah. Okay. Yeah. So my name's Sonia. I'm a junior doctor. I work in London. And I first I started thinking about coronavirus in January when we had a case come into, we had a gentleman come into our A&E who thought that he had coronavirus. He didn't have coronavirus. But I remember at the time our A&E was completely packed. We had nowhere to isolate him. He ended up just standing in our busy waiting room with, a good 50 other people, close contact. At the time, we had no hospital beds in our hospital. And I remember thinking, if coronavirus gets to England and if it's allowed to spread, we are, what's the polite way, but we're fucked. And, I guess the reality is our NHS has had, 10 years of underfunding. That's beds being cut, A&Es closing, the social care cuts, all of these things. We've had a crisis that's been created in the NHS by this government, which has left our NHS not even able to cope with a normal winter demand, never mind being able to cope with an outbreak. And then I think it was about 3 weeks ago, about 4 weeks ago, I started to become really frightened. And I could see what was happening in China and then what was happening in other countries, so in Iran and then Italy. And I remember, then I went on to the media and I did an interview, and I remember talking about, at that point, I was really starting to get angry, because at the point the government still had not had a COBRA meeting. The government was still refusing to go on the BBC to talk about it, despite the fact that we could see that coronavirus was coming. We were having people come to this country from infected areas and were not getting tested properly and not having contact tracing. And, at the time I said, we need to start thinking about now how to increase capacity in the NHS, because we do not have that capacity. And we need to be putting measures in now to stop the spread, because our NHS would not be able to cope. And I guess what, I find so infuriating is that, and I wasn't the only person saying this. And if me, as just a normal junior doctor, was thinking this, what the hell was our government doing at that time? And look, I'm not going to mince my words. I think the government's inaction, the government's delay, the government's hesitancy to do the right things that are needed to control the spread of this virus, and their lack of preparedness to deal with this will cost lives. And that is something all of us healthcare workers know. The past couple of weeks have been very difficult for healthcare workers, but we know that the next few weeks are going to be really, really difficult. And knowing that our government could have done more to protect the lives of the people that we are treating is something that is just really quite difficult to think about. I think, though, going forward over the next few weeks, I think the left, we've got a really important job here. It's so important. We have to step in where the government hasn't. I can tell you, just from the past couple of weeks, I've had to stop doing a lot of my community clinics and do much more hospital work. But there are some really vulnerable patients who are being left in the community without their support. We have many elderly patients, many of my patients with quite severe mental health issues who are not going to be getting the support that they needed. And I think all of us now have a responsibility to step in and provide that support needed over the next few weeks. But then I do think as well, the left, we have lessons that we can also learn from this. I think this crisis has exposed things that actually we already knew. They've suddenly found money for our public services and for our healthcare services. I think, you know, it has shown that actually the underfunding of our NHS and our public services is not just dangerous, but it also was a political choice. The government have shown that they can, if they want to, make it easier for people to access welfare support when needed. Again, that was a political choice to make it so difficult. And then I think as well, you know, if in the next few weeks, it is going to be these so-called low-skilled workers, which the government, you know, quite disgracefully calls our care workers, our cleaners, our porters, who are actually going to be keeping people alive. And again, we need to learn that and make something that we know as a truth. So I guess going forward, we need to make sure that these lessons that I think these truths that are things that we always knew to be truth, that is now being exposed as reality. We need to make sure that these things are not forgotten after this crisis. And then I guess also going forward, we do need to think about after this crisis, how. Actually, no, I'll stop there. Sorry. Too much to say. But yeah, we need to, there's how we react in the next few weeks, but also lessons that we need to learn going forward, and make sure that people do have short-lived memories, and we need to make sure that the people are aware that this government created this crisis, their ideology will cost lives. And just one more thing I'd like to mention. I remember during the election time, and I was talking to colleagues of mine about, you know, why they're voting Tories, and they used to say to me that they thought Labour's heart was in the right place when it comes to the NHS and the people, but they thought that the Tories were the party of competence. And actually, I think this crisis has shown that the Tories don't have a heart, neither do they have competence. So again, we need to make sure that message is clear to the public.
Thanks so much, Sonia. I mean, just on what you have said alone there, we could spend days and days and days analysing every single part of it. I think my hat is taken off to your profession and every single other person that works in a hospital setting right now. I just think, you are walking into a place where there are very, very sick people, and you have to go home and you have to mentally process that. So just a huge, huge thanks from, I suppose, all of us here, all of the people watching, and stay with us and come back on another programme to talk about that element that you stopped yourself from saying. And because I think it is right to concentrate right now on where we are at, on making sense of this. You talked about delay and inaction costing lives. That is a serious, serious proposition. That is a very sobering thought. And I do want to move on now to Lindsay German, who is also going to offer us some of her initial thoughts on this crisis. Lindsay, I'm just going to unmute you. Over to you.
Hey. Thanks very much, Laura, and it's very, very good to be here, and it's been so good listening to Sonia and Kevin about what so many people, so many working people are doing in the face of this crisis, that the health workers are doing all these things, the teachers are playing an absolutely vital role, which is necessary, so are supermarket workers, so are delivery drivers, so are people who are cleaning the streets, who are doing all sorts of jobs that are absolutely vital for us now. And I think the first thing I feel really is that we've now had, as Sonia said, we've had more than a decade of austerity now. And this is something where the NHS has been run down, all of our public services have been run down, but not just the public services. We've had outsourcing in the private sector, which has meant that many of these vital workers are paid in very, very, very low wages, minimum wage. So even if they get 80% now, that is 80% of the minimum wage in many cases, and they are very, very insecure in their jobs. And this is why we're seeing so many people still. There's a combination of employers who seem to think that advertising call centres should still keep open, or people, I saw yesterday somebody who puts labels on bags of dog treats that still has to go into work, that these are the kind of jobs that we're being told are vital to keep the economy going. And I think the first thing that we need to say out of this crisis is there is nothing more important than people's health, than the health of people around the world, and there's nothing more important than dealing with this crisis at this particular time. And I think it's important because we're talking about it in Britain. We're one of the richest countries in the world. And I agree very much with what people are saying about we don't have the resources. We haven't had the testing, which seems to me absolutely criminal in terms of what could have been done to actually isolate the virus. And we've left this so late, and it's still very, very late. But it's also about, there's a whole international dimension to this. There are whole parts of the world where people don't have access to safe medicine, don't have access sometimes to water, to basic resources. Kevin made the point that there are sanctions on Iran in place from Donald Trump, but of course not just in Iran. A number of countries are under sanctions: Cuba, Venezuela, North Korea. It seems to me in the world that we face now, where this virus does not have any notion of borders or any of these things, why are we penalising countries who aren't then able to get medicine, or who aren't then able to feed themselves properly? This has to be ended. And I think it's a very, very important part of this, that we have to look at this as an international question as well as a national question. We've seen it's come from China, and then to Italy, and then to Spain, and now to us, and now to the United States. And it's going to go everywhere unless we act very, very quickly about it. And I think the things that I just wanted to say were a couple of things. One is, I think the crisis has shown us the best and the worst of the society in which we live. You know, the worst, I would say, are the Tim Martin from Wetherspoons who didn't want to pay the wages of his employees, the Sports Direct who wanted to keep their shops open to make a profit because people might want to buy bicycles and might want to buy equipment, sports equipment, those sorts of people. We know about those people. The construction sites that are building luxury flats that are still staying open, I can see no justification for that at all. Those are some of the worst things of this society. But then we have some of the best. We have the tremendous work that the health service workers are doing, but also the solidarity that people are showing with each other, the kindness and the respect, and the way in which people, I know from my own experience, I'm sure everybody else does, the way that people, neighbours and friends and work colleagues and all sorts of people are really trying to do everything they can to help people and to do something to make sure that we fight this. And I think they stand in quite a lot of contrast to what we've heard from the government, which has at every turn has been very, very slow, has still, we are talking about, okay, they will provide 80% of money for 3 months, but there's all sorts of issues where people may not get this money or still have to pay their rent. We're now told that people still will be evicted, but they can have 3 months notice rather than 2 months notice. So those are some of the things that I think we have to deal with. I think that when we look at, although we don't know what's going to happen in the next few weeks, and we don't know the future and the longer term, I think we also do have to think that a crisis as big as this, it will change the minds and the lives of millions and millions of people. And people will start thinking about, why do we have to live like this? Why do we have to work in the way that we work? It surely should mean the end of austerity, but it should also mean that we begin to look at what work we regard as valuable and what work we regard as useful work in our society. And when you look at what I thought was a rather extensive list of essential workers that the government produced, it didn't include the bankers. It didn't include the people speculating on the stock markets. It didn't include those people. So those are questions for us. And just finally, I think the big question is, even though we're isolated at the moment, even though we have these great ways of meeting up, but we're all in our own homes, we're all doing things separately, but we have to organise. And that is what's so good about the thing tonight, where we can all applaud the health workers. But we have to find ways of doing this all the time, because it's not good enough to say, yes, we're all in it together. It's not good enough to say that everybody is suffering the same. Everybody isn't suffering the same. And we don't want this at the end of it to go back to business as usual. We don't want the same people who allowed austerity, who want to employ people in insecure employment, who want to pay the minimum wage. We can't allow those people to dominate the agenda. So I also think it's about what we do going forward. And we have to organise. We have to organise through the People's Assembly, through the unions. I'd like to make a suggestion. I'm sure Kevin will be happy to hear this, but I'd like all the unions to say that they will open their doors to whatever worker would like to join them, and that they have 3 or 6 months free membership, so that we encourage people who haven't been part of unions so far to see the value of being part of the trade union and how we organise. And I think if we do that, we have a terrible thing that we're experiencing now, and it will get worse before it gets better. But then out of that, hopefully, we can build a world which is much more based on the kind of social values which treat people equally and treat people fairly, and where working people really get a fair deal in society in a way that they don't at the moment.
Thank you so much, Lindsay. And I know I do want to get in some comments from people who are watching, and we still have Grace to hear her contribution too. What if you are watching right now, could you please share this meeting so that a wider reach can see what people are saying here. We want to pull in people who wouldn't traditionally come and watch the People's Assembly meetings or come out to a People's Assembly meeting. We want everybody to be able to access political content in this time. I think it was very interesting what Lindsay said, in that there is not one way that people experience this crisis. There is not one way that people experience this virus. And of course, you know, not many, I'll be hard pressed to find any people on the minimum rate of hourly pay who are able to work from home, because those jobs are crucial in kind of keeping our society ticking over. And for those people, not having a direct contract of employment, not having certainty over what they will be entitled to, forces them out the door and very often into danger. And that is, you know, just one of the reasons why we have to get organised, keep campaigning. I am really pleased to hand over to Grace Blakeley now, who is an economist. And I want to kind of ask you, before, I know you have to rush off to another meeting, it's so busy not having to leave the house. But I want to ask you how the government is able to do this, because, you know, I, in the general election, had to answer time after time after time, how are you going to afford this? How are you going to pay for it? This is ludicrous, the spending plans. You couldn't possibly give working people those kind of entitlements. How are they doing this? And what would you like to see them do more of? Where are the gaps, in your opinion, Grace?
Thanks, Laura. So yeah, as Laura said, I haven't got very long because I've got to pop off to another meeting, but I'll just have my kind of 5-10 minutes on the issues that are gonna the coronavirus is gonna have on the economy. Starting with Laura's question about how is this happening. You know, there are 2 major ways that the government can kind of raise money or inject money into the economy, and at the moment they're using both on full power. The first one being that the government can borrow and spend out of you know, through government departments, through the Treasury, etc. And the other one is that the government can kind of create money through the central bank and use it in various different ways to kind of boost the economy. At the moment, what we see is that we've both had big increases in government spending itself. So in the budget, what was it, a week or 2 ago now, time is just vanishing in this weird state at the moment, but whenever the budget was, we had what seemed then like a fairly big stimulus package being extra spending the government would be undertaking to kind of absorb the impact of everyone else in the economy spending less. We had what seemed like a fairly big stimulus package, but given the scale of the crisis that we're facing, it's actually not very big at all. We've also had the Bank of England stepping up and saying, right, we're going to create tons of money, just like they did through quantitative easing, and we're going to use it to basically to inject it into the financial system by buying things from financial investors. And together, along with the big package of loans that the government's announced, so the government's announced a lot of loans to big corporations, as well as the guarantee for 80% of workers' wages, and some injections into the universal credit system, that basically is going to have two effects. On the one hand, it's going to increase government debt, and on the other hand, it's going to increase the amount of stuff that the central bank owns, so the size of the central bank. And neither of those things matter that much for a big economy like the UK, right? So the US government has announced a stimulus package worth $2 trillion. That's a staggering amount of money. And the Federal Reserve has said it's going to create an endless amount of money to be able to deal with this crisis. What we've obviously learned from this is that big rich economies don't really have a limit on the amount of debt they can issue, on the amount of money they can create by the central bank. And the reason for that is generally, especially right now, but more broadly, is because how does the government raise money? How does the government borrow money? It either, as I said, issues bonds, which means that it sells pieces of paper to investors and says, here you go, I promise to pay you back in X number of years. And as long as that promise is valid, as long as investors think that's a worthwhile promise, they'll hand over the money. With central banks, they can literally create money out of thin air and use it for however they want. And the only issues really that you see emerging if the government does that too much is you get inflation. But at the moment, that's very, very far away from everyone's minds because if anything, we've got the opposite problem, not enough inflation, prices being too low. So, we're seeing now actually that all this stuff around, the government can't afford this stuff, that Labour spending pledges were way over the top, completely and utterly ridiculous, right? Because we know that wealthy states can afford to spend in order to either invest or to boost the economy at moments of crisis. Basically, the question that one has to ask when the government is spending in this way is it going to boost economic growth over the long term, or is it going to reduce the fall in economic growth that is resulting from a crisis? And as long as the government is borrowing money in a way that is going to boost growth, or that is going to increase people's incomes, or perhaps reduce inequality or increase productivity or the efficiency of our public services, then it's fine because you'll claw back those revenues through higher taxes over the long run. The one thing I do want to say, and it links to what Lindsay was saying, is that I've had a piece out today talking about, how this argument differs in different parts of the world system. Because yes, it's true that in the global north, governments can basically print as much money as they want. The most extreme example is the US. The UK is pretty powerful. A couple of Eurozone states like Germany are also pretty powerful. But for a lot of countries, this is not possible. And that's because, I said about giving the piece of paper to an investor and then saying, okay, I promise to pay you back over X amount of time. Those pieces of paper are only worthwhile when they're issued by governments that investors like, i.e. that financial institutions like and they trust. And for a whole host of reasons, because these economies are smaller, because they're less powerful, often because they have fewer economic tools at their disposal, countries in the global south are much less able to do that. And in fact, what we've seen is investors fleeing the debt of countries in the global south, which is making borrowing for them more expensive and coming into assets in the global north. And basically what that is going to mean is it's going to be very, very difficult for global south countries to be able to deal with this crisis. Their economies are going to shrink, and at the same time, their spending is going to have to increase, all whilst borrowing for them might become more expensive. So again, when you're making this argument about the ability of governments to raise finance, the important thing to remember is it all depends on power and politics. If people want to buy your debt, yes, you can issue as much debt as you want. And as long as inflation isn't too high, you can create as much money as you want. But there are limits on this for particular states, and we have to be very mindful of that and have solidarity with those countries to ensure that maybe, we're lobbying for us to use our power in a way that's going to support them. The other thing that's linked to this, that's potentially a big issue in the crisis at the moment, is more broadly, not just debt by governments, but private debt. And for a very long time, we've had some big problems in the UK economy, but also the US and some other big advanced economies with very, very high levels of private debt. The global debt burden now at the moment is about 3 times the size of global GDP, which is bigger than it's ever been. And in particular in the US and the UK, there's lots and lots of corporate debt. And this is why governments were really quick to say, we'll give loads and loads of really cheap loans to businesses, is because they knew that a lot of businesses are over leveraged. They've got way too much debt. compared to their incomes anyway, compared to their assets anyway. And this is obviously going to reduce their incomes and mean that they're less able to pay their debts. What happens if businesses can't pay their debts? They think, right, we're going to sell all our stuff to be able to pay our debts. When everyone sells their stuff, then the price of that stuff falls. So you start seeing property prices fall, share prices fall, etc. Then everyone else who's held on to their stuff sees that it's less valuable. So they think, right, I better sell it before it goes down in value even more. And this creates the kind of problems that we started to see in the financial crisis with regards to private housing. So people feel they're over indebted, they can't pay their debts, they sell their stuff, prices fall, they're even more over indebted, and it creates this downward spiral. So that's what governments are trying to stave off at the moment. But if they're doing this, the measures they've taken so far have been done on the assumption, and this is a really important point because it's something that we really need to push back against, that this is going to be a V-shaped recession. So basically, everyone's going to stop doing stuff for 3 months. The whole economy is going to stop working. The government's going to step in and help. But then when the immediate crisis is over, everything will go back to normal, right? And this is obviously not true for a whole bunch of reasons. Firstly, this big problem of debt. So the fact that governments are just, piling new debt onto old debt for corporations, it means that this problem isn't going away. Also, households, so you and me, are going to have the problem of paying our debts when our incomes are lower, as well as paying rents and meeting all these sorts of obligations. And over the long term, there's really no telling what the long-term economic impact of this crisis is going to be. Firstly, obviously, in terms of the scale of the number of deaths, but also in terms of the impact on productivity, on investment, on all different things that determine how the economy grows over the long run. So we need to be pushing back against that. And the final thing that I want to say is that it's really, we need to really use this crisis as a moment where we can develop the arguments we've been making about austerity. Because for a long time, we've kind of had this thing of, the state isn't big enough. And if the state was only a little bit bigger, then everything would be fine. Actually, what we're going to see in this crisis is it's not enough for the state to be big, that if it is actually acting in the interests of a very small number of people. And you can see this with the fact that it's guaranteed mortgage loans that hasn't provided any support for private renters. That's helping older people at the expense of younger people. You're going to see this a lot through the crisis, is that Boris Johnson's government is going to be helping the people that it is close to and that have supported it and that are the basis of his electoral coalition. So yes, public spending is going to increase, and we can't say that it isn't. We can't say that these measures to support working people aren't good. They obviously are good, and it's good that the government is doing that. But over the long term, we have to think about whose interests are the government really working for? Who are the people whose interests they're trying to represent? Who are they trying to save here? And how is that impacting what they're doing? And the only answer to that is not just to say the government needs to spend more, it's to say that ordinary people need to be having an input into what's going on and pushing the government to act in their interest. So it means real democracy at every level of the state. I'll stop there, and I have to get off. But if you have any more questions about what I've said, feel free to tweet me or try and contact me in another way. So thank you very much for organising this.
Or read your book that you've just published, because that was a whistle stop tour. That was a whistle to stop tour of how essentially the paradigms of what the state does is changing, and probably will have changed forever after this. And a very, very good point about the exacerbation of the inequality between the global north and the global south, and what long-term impact that will have. So thank you for raising those points and making us think about that, and enjoy your next meeting. Thank you, Grace.
Thank you. Bye, guys.
I want to go straight to some questions. I've got a question. First of all, for Sonia, if that is okay, from somebody called Octay, and they are asking, does the creation of 4,000 new hospital beds in the ExCeL Conference Centre help? Is it enough to kind of contain this exponential growth in the number of people needing beds?
We need hospital beds, we need ITU beds. This should have been started weeks ago. So it takes time to create capacity. So we're talking about, it's not just about putting a bed in place, a physical thing, it's about getting the ventilator there. But most importantly, it's about having the staff to use the ventilators. So you need staff that are that are critically trained. So you need anaesthetists and you need intensive care nurses to deal with those beds. So we have a shortage of those doctors and those nurses that are critically trained in that, and it will take time to upskill them and train them. So it is definitely needed and it will help, but it is weeks too late in what we're doing and what we expect. So from conversations that I've had with colleagues over the past few days, we're expecting to run out of intensive care beds in London by next week. So and there's one London hospital that has already maximum capacity in intensive care beds. So yes, it is helpful, but the delay here, as I said before, it will cost lives, and the government need to be held accountable for that.
Thank you. And I'm just sensing, I hope this isn't kind of a misjudgment, but I'm just sensing like a real frustration in your voice around your ward in science, but not just you, your professional body, and being ignored for so long, saying that a big crisis like this could really damage our system.
Yeah, I am livid, to be honest, from what I've been seeing over the past week. The conversations that I've had to have with colleagues, the conversations that I've had to have with some of my patients. I'm livid. I'm livid that we're in this situation because it wasn't inevitable. And actually, if you look at some other countries, if you look at South Korea, if you look at Singapore, if you look at Taiwan, countries where the government acted quick and they took action and they were prepared, they have managed to control the spread and reduce the number of mortalities. And this government didn't act. And they ignored warnings from frontline staff. They ignored warnings from the trade unions that NHS does not have the capacity to, never mind just deal with current demand, but would not be in a place to deal with the virus, with any outbreaks. And the government ignored that. And yeah, I am angry. I'm also angry that, right now, not just healthcare workers, but many workers are going into work, putting their health and their lives at risk because the government hasn't got in place proper protective equipment. It's shameful. Like, in my team of doctors, one of the doctors, she has recently had cancer treatment, so she's really highly risk. She's having to go to work. We haven't been given proper masks. We ran out of hand sanitizer in our doctor's ward a few days ago. So these sort of simple, basic things of protecting workers are not being done, and it really is shameful. And I'm trying to sort of, we all have to sort of, as our job, as healthcare professionals, we need to just keep calm and do our best and provide the best care possible for our patients. But it is really, really utterly shameful that this government has been so unprepared and left workers on the line having to deal with this without the support and the protection that we need to protect our health and to stop this virus spreading to our vulnerable patients. And after we've dealt with this outbreak, we do really need to look back and look at this shameful government's response, and people need to be held accountable for that, I think.
Thank you, Sonia. I'm going to hold my hands up and say I've managed time pathetically. And so we'll probably only have time for Lindsay and Kevin to give one more contribution each before we go off and take part in our collective solidarity towards the NHS. Somebody said, well done, Kevin, for as ever highlighting the need for international solidarity, not least with Cuba. But I want to just take us off the virus for 1 second, and this is about education. Somebody asked if this would have a knock-on impact, the virus, and expose issues like the way the government examines people. So the action that people, and I know Lindsay has experience of this as well, but the action that you're having to take, teachers are having to take in assessing students is obviously not the way they are in school, the kind of exam and exam factory. Do you think this period will have knock-on consequences for education in the future?
I hope it does. They've stopped the GCSEs and the A-levels, and I said that we supported that, even though it's really disruptive for the young people involved in it. But we don't need GCSE exams. Other countries where children leave school, where young people leave school at 18, you don't have a major set of exams at 16. The exams at 16 are, in this country, they're helping people decide which A-levels to do. We shouldn't specialise as much at A-level anyway, but teachers can help them make those decisions. And actually, what the government is now doing is saying that they're going to use teacher assessment. Teacher assessment has always been good enough to do that. So the work we're doing, we shouldn't be putting young people through those exams at 16. And the exams that we've called on the government to cancel in primary schools, the SATs tests. Now, again, some of those children are preparing for those. They'll be, to some degree, they'll think, oh, I've been putting work in, but those tests are completely, utterly pointless. They are just destroying learning. So I hope, and when you think about it, when you ask yourself the question, can we do the GCSEs next year? Now, the children do GCSEs in year 10 and year 11. There are 6 terms in those 2 years. The 6th term is the exam term. So there are 5 terms in which curriculum is taught. And we're going to have missed a term and a half. It's more than a quarter of the entire curriculum preparation time is going to be gone. And those exams they certainly can't work in the same way next summer as they would have done if this crisis didn't happen. We want government to think with us and talk with us about how better we can assess children in those circumstances. There's a question of what kids should be doing at home now. And I think in some cases, teachers worried about children getting ready for those GCSEs next summer will be trying to help them do that sort of curriculum preparation, but that's really not going to work very well. There are such different home lives. There are children sharing bedrooms with brothers and sisters where there's one laptop or no laptops at all in the household. Even in better off households, there's mums and dads who are at home working, and the kids can't. We should not be in this summer term trying to replace the education that kids would have done in school. We can't replace it in this new circumstance. So we should be trying to think a bit more expansively about, can kids think about a project? Can we do some work where kids can talk with one another online? There would be some advantages in doing that. So I do hope that this makes us all think about what education is for at the end of this process.
And I suppose there'll just be, that's an excellent point about, children just not having the resources and having all of these expectations alongside of it. And I suppose we are all just going to have to accept that there will be psychological ramifications to this. There will be children who are scared, they won't really know what a virus means, and they might become scared of going out, and we have to kind of manage those children's feelings. They are very important alongside that academic success. Yeah. So we probably won't be able to come back to you before I go to Lindsay. I just want to say, Kevin, thank you so much for all your union stuff. And please come back on this to update us with how your members are doing during this crisis, that they are safe and well. I want to go to Lindsay really to kind of conclude. We might have time for a little, if you want to chip in one more time, I don't know. Just give us your thoughts. What should the movement, after what we've discussed tonight, what should we be concentrating on? What are some of the demands, some of the actions that we need to take for those people that are left behind, or those industries, those sectors that are really experiencing hardship right now?
Well, I think firstly, the first things we need to do is to make sure that people are as safe as possible. And I think particularly the question of employers, when people don't want to work, where they think it's dangerous to work, there should be much, much stronger rights for people to say, I'm not going to work. And I think if you look in Italy, for example, there's been strike action across Italy because people have been saying, look, we're not going to work in dangerous situations. We're not going to be in a car factory where we're right next to somebody. So I think we need to think of those things. But I also think we need to think, as people have said, if the government has money where it's suddenly, remember in December, you can't have a 4-day week. That's impossible. Now we're all at home. We can't have all this spending going on, whatever it is. Now they've effectively nationalised the railways for 6 months to deal with the loss that the private companies are going to have. So I think the big question, as Tony Benn always used to say about this, when people came out of the Second World War, they said, if there's money, why should we go back to unemployment? If there's money for guns, there's money to create jobs. If there's money there to bolster private profit, there's money to make sure that we can expand our public services and we can give everybody a decent wage. So I think these are the kind of things we've got to be talking about.
Thank you so much, Lindsay. This will undoubtedly change our communities, our expectations, and the way we live forever. And we have to, as a movement, make sure that those people who are being put in harm's way are protected, supported, that we continuously look out for who is suffering, who is being missed out, who is being left behind, and we make sure we are there defending those people. I want to say thank you to all the contributors. This is just the beginning of the conversation. As I said at the beginning of this programme, it is such a bewildering situation that we are in. We need to get together more often, not less often, to try and make sense of this crisis. We are going to leave each other now to go and clap for the NHS, for every single worker in the NHS, and I want everyone to stay safe, stay well. Please reach out to those mutual aid groups online who are providing support. If you are on your own, there I'm sure will be people who can help, and also link up with your local People's Assembly. We are exploring new territory here. We are campaigning, gathering online. If you have any ideas for how we protest more effectively online, how we make our voices heard online, please get in touch and join us next week at the same time, so 7 p.m. from the People's Assembly page or my page or any one of the contributors' page. I'm sure they'll share it. And next week we're going to be talking about mental health and different aspects of this crisis. Stay safe. Let's go and show our appreciation to the NHS. Thank you.